Alright guys, so in this video we're going to talk about the confounding versus effect modulation, and we'll also kind of touch on the difference between the ANOVA, chi-square, and the t-test and such. So this will kind of round out the rest of the biostats that I'm aware of, and hope you like the video. Alright guys, so question number 1, it says, a new medication is aimed to treat schizophrenia, works on the NMDA receptor as an antagonist. A prospective study shows that women who smoke, that the drug increases the risk of deep vein thrombosis. The relative risk associated with this phenomenon is 1.5, with a p-value of 0.02. In treated non-smokers, no risk of DVT is evident. Relative risk is 0.95, a p-value of 0.45. This finding is an example of which of the following? So, long story short, when you see your answer choices, and it's like they have they did a study, and then when they kind of threw in this extra little piece here, it changed the results, because the relative risk, it looks like here, is 1.5, meaning it's 1.5 times greater, and then as p-value, remember we want a p-value less than 0.05 to make it significant, right? Because this is like saying this is the chance of it occurring by chance. But then when they said, look, if we in treated non-smokers of this, then everything kind of went different, right? It went from 1.5 almost to reverse, right? Because if it's less than 1, then it was like almost like a reduction. But p-values pretty stinks. It's way too big. But when you see the difference of when you see confounding and effect modulation in the answer choices, you know that they're probably leaning in that direction. But you got to know the difference between the two right out of the gate. So with a confounder and effect modulation, and actually it's pretty easy, that'll work for step 1, step 2, is that a confounder, okay, think of it like this. You draw it out and then have exposure and outcome, exposure and outcome, okay? And this is a simplified version of this, is that a confounder affects both the exposure and the outcome, whereas if it's an effect modulation, it only affects the outcome. Now, in this question, it started talking about there's new medication, and that it showed that this medication, okay, so that's the exposure. And they were looking at an outcome of DVT. But then when they kind of did a follow-up on this, they said, well, look, what about smoking? Okay, because they treated non-smokers, they had a different reaction. So smoking, we have to determine whether that was a confounder or an effect modulation. And it's real simple. If it affects, you ask yourself, does smoking affect DVT? And we say yes, well, we know that. That's kind of a given. And plus, it was kind of proven in this. But does smoking, in theory, affect medication? We don't know, okay? And there's no evidence of it. So the smoking only affected the outcome. So then we say, oh, well, that's effect modulation. Now, think of it like this. In a confounder, the most common one they like to use when they do smoking is think if they did a study that said if alcohol increases the risk of pancreatic cancer. Okay, so if you did that study and then you teased out smoking, could you say that smoking affects alcohol? And you say, well, yeah, chances are that if someone who's an alcoholic, chances are there's an increased level of smoking. So smoking does affect alcohol, check. So that's the exposure. And does smoking also affect pancreatic cancer, or is there like a higher association with that? And you're going to say yes, it is, because it'll be in the question, or it's even known. So if it affects just the outcome, you go with effect modulation. If it affects both the exposure and the outcome, you'll go with confounding. Now in this situation, it's a medication, so the smoking or the non-smoking and smoking didn't affect that, but it does affect the DVT. So it only affects one, and then we go with effect modulation. And just like on the STEP exam, they're going to put chance of choice A is going to be the one they're just going to dangle that in front of you, hoping that you jump on it. But you got to understand, confounder affects both. Effect modulation just affects the outcome, one piece of it. Okay? This question says, a group of researchers perform a prospective study that reveals an association between, I should have done this one first, between alcohol consumption and prostate cancer. The relative risk is associated with this finding is 1.7 with a p-value of 0.02. Okay, so these are good. Then they split the group into smokers and non-smokers and then re-examined the findings of alcohol intake and prostate cancer. The results were as follows. Yeah, I should have had these backwards. It would have been a lot easier. So at first, when they do this study, relative risk is 1.7, so it's 1.7 times greater. Okay, and let's just write this out. Exposure, and there's going to be the outcome or disease, and the exposure on this one is going to be alcohol, right? And then the disease is pancreatic cancer, and then we have to determine smoking. Okay. Now, is this smoking going to be an effect modulation, where it only affects the outcome, or is it going to affect both? And of course, we just talked about this. So, and if we looked at it, again, does smoking affect the alcohol? Yes. Does smoking affect the association with pancreatic cancer? Yes, because when they really teased this out, you could see that it went from a 1.7 with a nice p-value to total kind of garbage on the p-value, and then of course these relative risk changed significantly. So as I say, initially the data looked good. Okay, it looked good up here until they teased out smoking, and then everything went south. But once again, if this is associated with both the exposure and the outcome, you got to go with confounding. I think when I typed these up, my original intent was to have this question go first, because it was almost like a giveaway thus far. Now, if you see the word confounding, and that's what your choice is, because it affects both exposure and the outcome, they might do a follow-up question saying, how do you compensate for that, or how do you associate that? And that's where you're going to say, you're going to do stratified analysis, okay? And just remember, confounding is a bias, okay? It's a bias. But you're going to do stratified analysis. Again, confounding affects both exposure and the outcome. Effect modulation just affects one of them, okay? Now, this one says, plasma vitamin D, 25OH, levels are measured in patients with coronary artery disease. The mean vitamin D levels of this group was measured at 19, here's normal, with a standard deviation of 1.1. In a separate group of patients with similar demographics, the mean vitamin D levels are 17.5. Okay, so they're talking mean here, mean here, with a standard deviation of 1.4. Which of the following tests should be used to compare the mean of vitamin D levels? Okay, so this is just a basic kind of definition, because when you look at your answer choices, you got an analysis of variance, or ANOVA, two-sample t-test, meta-analysis, observer bias, or chi-squared. To get through the STEP exams, really all you have to do on this one is know a couple little facts. In this question, they're comparing two sets, right? This set and that set. It's the mean, so they're comparing two means. So if you're going to compare two means, as simple as it looks, it's going to be a two-sample t-test. You might see something that says a z-test, but we're not going to, that's, more global per se. So a two-sample t-test compares two means. Now that's what this question says, but you got to know the definition of these other guys. If you were comparing two or more, or always just think of three, okay? Three or more, sorry, not two or more, it's three or more, you're going to think analysis of variance, or ANOVA. How many syllables are in this? ANOVA. Three. So three syllables, so you got to at least have three means to compare, okay? If you're comparing just two means, you're going to go two-sample t-test. And then if you're comparing three or more means, you're going to go analysis of variance. Meta-analysis is just that when you're pooling more data, okay? You're pooling data. And what's that going to do? The more data that you pull into a study, that's going to increase what? It's going to increase power, okay? So meta-analysis, and they like to use this as an answer choice a lot when they do, I've seen it multiple times, those drug ads, because they're always pulling in extra data or something to that effect, and a meta-analysis somehow built in there. Observer bias, this is just more of a distractor in this type of question. That's really just a cognitive bias, by the observer that might influence the participants. Now, chi-square, think of it like this. Chi-square, anytime I see a box, I'm going with chi-square, okay? This basically measures, proportional data, okay? Proportional data, okay? Category or proportional. So anyway, long story short, if I see a box and they tell me to compare stuff in there, I'm going with chi-squared. If I compare two means, I'm going two sample test. If I got to compare three or more means, I'm going analysis of variance. If they talk about pooling data, I'm going with meta-analysis. Now in this one, a study was performed to assess the association between light box therapy and vitamin D levels in patients who underwent treatment for major depression with ECT. The data from the study was given below. Okay, we have light box therapy, no light box therapy. Normal vitamin D levels were in 45 people with light box, 35 with no. Low vitamin D with light box therapy. I probably should have, if I would have made this more accurate, probably should have went like that, right? Because you would think the light box, if they had light box therapy, you should have more people with that is right. Light box therapy should have normal, so yeah, there'd be a lower number here. So, okay, I had it right in the first time. So, anyways, it's a chart. Which of the following is the best statistical method to assess the association between light therapy and vitamin D levels? So again, if I see a 2x2 table and they ask me to compare that data, and they're not going to, if they're not asking me about sensitivity, specificity, probability, all that kind of stuff, because that's easy, right? If my answer choices are these, and I see a box, I'm going with chi-squared. Okay. Now there might be a fancier way to do this, but if you just want to get through step 1, step 2, step 3, this will work. Okay. Analysis of variance. What is that? Remember, 3 or more means to compare. Two sample t-test. You're comparing two means. Now, you also have to have, just as a technical piece, you got to know sample size. They got to give you standard deviation, and of course you need two means. So, anyways, analysis of variance, 3 means. Two sample t-test, 2 means. Meta-analysis, pooled data. Okay, increases power. Chi-square test. Anytime I see a box, it's categorical. You're comparing categories, or I always like to think proportion data. Okay, but if I see a 2x2 table or a box, I'm going with chi-squared. All right. This one says, a prospective cohort study was performed to assess the role of daily vitamin D intake in occurrence of kidney failure. The study revealed a 7-year relative risk of 1.2 for people who consumed 500 international units compared to those who do not. Okay, so that's saying there's 1.2 greater times chance of kidney failure if you take a bunch of vitamin D, or 500 units daily of vitamin D. The 95% confidence interval was from 1.05 to 1.4. Now, without me telling you anything, is that good or is that not good? This is where you're going to tell me it's good, because why? It doesn't cross 1.0. And I can't stress that concept enough. If at any point that you see a confidence interval that crosses 0, you're going to say the data is kind of void. And I'm telling you, that's how you're going to get through those drug ads, because they're going to give you a lot of this kind of stuff, and you're automatically going to say there's no association, because at some point it was equal. The exposure, there was no difference between exposure and non-exposure on the results. So just the fact that my confidence interval stays above that, then I know, hey, this is a good study. It's got a relative risk of 1.2, meaning it's a 1.2 times greater chance, and my confidence interval looks good. Which of the following p-values is most consistent with this? Okay, so if everything checks out, which of these is a good p-value? Now you know that a good p-value must be what? Should be less than 0.05. Okay, it's kind of a given. So which is the one that we can use here? Well, I don't see 0.05. Well, we said it can be less than that. So you got to go with answer choice E. Okay? And remember, this is just, when we did the whole null hypothesis stuff, alpha era, also known as p-value, and we want it less than 0.05. Okay? Very important, because We want this low, 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 because that's saying what is the possibility of something happening by chance, and we don't like that. We want that really small. Now, if you notice on all these questions, I use vitamin D. You know, it doesn't matter what you use. The point to learn here is the concept behind all these questions, is to understand what's a confounder versus effect modulation. You know, what are the differences between those tests? Analysis of variance, 3 means. 2-sample t-test, 2 means. Meta-analysis, pooled data, and chi-squares when I see a table, okay? And it's all you need to know, and that'll get you through the exam. This question says, you are asked to evaluate the efficacy of a hair loss medication that is being marketed as the one. The results of a randomized control trial at 7 years is shown below. Okay, I got a little box here. So, okay, I'm not seeing any of this chi-square stuff. Good. What is the number to be treated to prevent one person with androgenic alopecia with this new medication? Okay, and this was kind of requested by a person who left it in the comment box and who just wanted me to work on another problem with the number needed to be treated. And I could have just said that. I should have said, what is the, you know, how many, you know, if I were to treat people, I could have just gave the definition for number needed to be treated, long story short, but I was nice and put it like that. So, we know that the number needed to treat is 1 over the absolute risk reduction, absolute value. So, absolute risk reduction is the event rate control minus the event rate with the treatment, or vice versa. It doesn't matter to me because it's an absolute value. So, this is the treated group with the medication. This is treated with placebo. So, hair loss. I probably should have swapped that, right? Because we want to how many to prevent. So it should have been no hair loss. I should have done that. Let's do it like that. We'll put no hair loss on top and hair loss on the bottom. No hair loss. 20 people had no hair loss. So that's kind of pretty bad data then. Well, we could do it the other way, but I think the answer choices were, when I made this, were for that. So if no hair loss was 20, and hair loss was still 80 on this one, but if they were treated with placebo, no hair loss was 40, so it actually, you know, it would have done better. This is pretty messed up data, but for the most, just roll with it for right now. Is if you're in the treatment group, you would say it's 20 out of, how many people had no hair loss, so they had a success? 20 out of how many? It's not 80, because how many people total? 20 had no hair loss, 80 had hair loss. So there's 100 people in this group, and 20 had no hair loss. So really it's 20 out of 100. Now in this one, it's going to be no hair loss was 40 out of what? Not 40 out of 60, but how many people were in this group that were treated with placebo? 40 plus 60, so it's 100. And you know how to know it was 40 of them had no hair loss. Okay? So it's 40 out of 100. Don't make the mistake of putting the 80 or the 60 in the denominator. It was out of 100, okay? Now, and again, don't worry about the technicalities of this drug. So with that being said, I keep my denominator. It's 100. 20 minus 40 or 40 minus 20, doesn't matter, absolute value, and I get that, which is basically 1/5, okay? So, and if I do all the simple math, however you learned it, I would get a number needed to treat of 5, okay? Again, the key with this number needed to treat, you gotta know the formula, okay? Is 1 over the absolute risk reduction, and make sure it's an absolute value. And then all you gotta do is find the treatment versus non-treatment group, and then make it a fraction, okay? Make it a fraction. Don't fall for the mistake of putting it over just how many were in the other group. It's how many were in the total of that section. And then if you just solve, you'll get a nice little number like that. Okay? So again, guys, I'd say you have to know that the takeaway of this is, again, confounding versus effect modulation. And you have exposure, outcome, exposure, outcome. And if it just affects the outcome, and I see it, then we're going to go with the effect modulation. And I'll be honest, a lot of the questions that I see, and the rule doesn't always stand, but if usually the exposure is some type of drug or medication, I would see it leans toward effect modulation. Now, confounding, that's usually like you're smoking, drinking, It can also be I've seen examples of like when they do a study of birth order and birth order with Down syndrome and stuff like that, and then they have to take in consideration the age and things like that. So multiple different examples. But if it affects both the exposure and the outcome, you're going confounding. If it just affects the outcome, you're going with the effect modulation. Analysis of variance, you're going to say 3 means or more. And if it's a 2-sample t-test, you're going to go 2 means comparison. And meta-analysis, you're going to say pooled data increases power. And then chi-square, you are going to be thinking, if I see a box, a table, anything that says you got to compare proportions. Okay? Hope this helps, guys.